Hi, good afternoon, everyone, and very warm welcome to today's webinar. We are delighted to have you join us for this informative session on two very important aspects of health that affect millions of people worldwide. Our first topic would be metabolic syndrome and how it affects our health, and it will be led by Dr. P. Ravikiran, who will shed light on the clusters of conditions that increase health risks and share insights on prevention and management. Our second session would be red flags for heart attack, will be delivered by Dr. Vinod Vadthya, who will help us understand the early warning signs of a heart attack and why timely recognition can save lives. We encourage all of you to stay engaged, take notes, and use the Q&A session at the end to ask your questions directly to our experts. So let's get started by welcoming our first speaker, Dr. P. Ravikiran. Before we go ahead, I'd like to introduce him. Dr. P. Ravikiran, who's a general physician and diabetologist, is a dedicated doctor specializing in the prevention and management of diabetes and metabolic disorders, with a strong emphasis on improving long-term health outcomes. So let's welcome Dr. P. Ravikiran. Please go ahead, doctor.
Yeah. So red flag signs are mainly warning signs. We can call it as warning signs for a heart attack. So heart attack warning signs we should not ignore. So silent killers we should not ignore at all. So heart attacks are a topic, most common topic nowadays. So where we are getting a lot of young patients affected by heart attacks. So heart attacks are a top cause of death, especially in India. Early symptom recognition is crucial. Every minute counts and it can save the lives. So in India, the statistics saying that particularly is very alarming now. The country accounts for approximately 60% of the world's heart disease burden, most probably from heart attack. Less than 20% of the global populations by the heart attacks only. Even more concerning is that heart attacks are in India tend to increase in younger patients compared to Western countries. With 50% of all heart attacks in India, men occurring before the age of 50 and 25% before the age of 40. So what are the warning signs of heart attack? How we can divide it? How can take a message from the warning signs? How can we can be saved from heart attacks? So recognizing warning signs of heart attack can be life-saving. A heart attack, medically termed as a myocardial infarction, occurs when the blood flow to the heart is whatever the arteries flowing to the heart is blocked. So depriving the heart muscle of oxygen and causing permanent damage to the heart. Contrary to this popular belief is that not all heart attacks are sudden or intense. It may, in many cases, symptoms are subtle and slowly developing and can easily be mistaken for less serious conditions like especially in women and older adults. So being informed about the early warning signs and symptoms of a heart attack, understanding the risk factors and knowing how to respond can significantly improve the outcomes and survival rates. So this guide offers a comprehensive overview to help to stay aware and proactive. So here we can see that heart attack, when there's a blood vessel, there's a red color blood clot is there. This is a lumen of the artery, the coronary artery, and here is a plaque. Yellow color plaque is there. So plaque will be over the period. It will be slowly. It will increase the plaque and burden will increase. But when stress increases, clot will be formed and total artery will be occluded, and blood flow to the artery will be occluded, and whatever the muscle supplied by the artery here you can say. So this artery will be damaged, and at the end of the day, dying of the heart muscle will occur. So what are the common symptoms of heart attack? What are the warning signs of heart attack? So most of the people ignore them, that they can mistaken that some gastritis or some muscle pain or neurological pain. So we can confuse with the symptoms. So first and foremost, when it comes to the heart attack, people aware of the chest discomfort, or when heart attack occurs, pain will be there in the chest. That's the foremost symptom. So This is the most frequently reported symptom. Patients often describe it as a sensation of the tightness, pressure, squeezing, or heaviness in the chest. We can call it as sometimes a big elephant sitting on the chest, we can say. So that much of pressure. When patients come to us and telling that some pain is there, when the patient shows his fist and showing that my pain, my chest pain is with the fist type of chest pain is there. But this pain, we can say, pressure type of pain, squeezing type of pain. It can radiate. Sometimes center of the chest, we can say. So left side, most probably left side, and may last several minutes, or it can come and go. Unlike sharp shooting pain, stabbing pain, this discomfort more persistent and diffuse. So neurological pain will be some radiating and sharp shooting pain will be there. But cardiac diffuse, one area, whole chest will be affected. So we should not miss the this symptom. And coming to the other symptoms, shortness of breath. Shortness of breath here, unexplained difficulty breathing may occur when patient having chest pain. Some individuals, especially in women, they experience extreme tiredness or weakness, sometimes days or even weeks prior to the heart attack. This type of fatigue is usually not related to the physical activity, and it can be one of the earliest signs of the heart attack. So we should not ignore in females that it can be females. We can say that female are less prone to cardiac problems, less prone to heart attacks. So we should not ignore. So when patient having these symptoms, we should aware of those, and we should refer to cardiologist or physician nearby. So another symptom is pain radiating to other areas. So when pain having in the chest, that pain may radiate from the chest to the other areas like shoulders, arms, back, neck, and jaw, or even upper stomach. This radiation pattern is a hallmark of sign of heart attack, and we should not ignore it. This pain radiating, we can say, when pain in the chest, normally a neurological pathway, nerve pathway will be there. This related to T1 to T4 dermatomes in our spine. Though these dermatomes will supply the respective areas, we can call referred pain in the shoulder, left upper arm, forearm. In these areas, we can get the pain. So pain, radiating pain, we should not ignore that. So always think of this one symptom, and especially if it is accompanied by other symptoms such as sweating, dizziness, and radiating pain. And in some patients, nausea, sweating, and dizziness and other symptoms we can observe. So these symptoms of sweatings and lightheadedness, feeling faint are common, particularly women. These signs are confused with indigestion, like gastritis we can confuse, or flu-like illness, which may delay the diagnosis and treatment. Uh, then another mini attack symptoms in females. What are the mini attack symptoms, signs, and females? We can here women frequently experience atypical or subtle signs such as indigestion, anxiety, disturbed sleep, or sudden weakness. These symptoms can be easily dismissed, which is we should aware of this. And many heart attack symptoms in females is very critical. So whatever the vague symptoms, we should not take it out that this is a simple. We should not take it as a cardiac problem. So always think of conclude it whether it is comes under cardiac or not. And other overlapping symptoms, I can say one patient of mine, uh, such as numbness, confusion, slurred speech, and sudden weakness, presented with these symptoms outside of the hospital, and they thought of the TIA, transient ischemic attack, or we can call it as some neurological deficit. They thought of that. Then they thought of that, and they started antiplatelets and sent to neurologists. But by that time, they have not taken ECG. ECG was the main clue for the diagnosis. Patient had inferior valve MI, right-sided heart attack he had that time. So in those patients, stroke symptoms mimics inferior valve MI. So always think of that, take one ECG and see whether always when patients come to the emergency, first and foremost go for vitals, and ECG should be taken. ECG is normal, then we can think of other probabilities. So always think cardiovascular problems will be overlapping symptoms and stroke. So differentiating between these two and acting quickly is very important. Why? Because heart and brain both are very important, vital organs in our body. Within fraction of seconds, within minutes, we need to act immediately within 45 days to 45 minutes to 90 minutes. So we can restore the blood flow to the brain and heart. So always think of that. So these are the warning signs what we have discussed. So what are the risk factors for heart attack? So what we can see here, understanding of the heart attack, sorry, stroke, there are the few risk factors influence the severity and the onset of the symptoms. First and foremost, hypertension. Chronic hypertension puts stress on the arteries and heart, which accelerated wear and tear. It's a leading contributor to the both heart attacks and strokes. So always go for regular blood pressure checkups and maintain your body weight, maintain your blood pressure in controlled rate. So then next, high cholesterol levels is the one most. So elevated LDL, we can call it as bad cholesterol, which can lead to plaque burden, plaque buildup in the arteries, reducing the blood flow, and ultimately it can stage a heart attack. Another one, smoking. Smoking damages the blood vessels, reduces oxygen in the blood, and increases clot formation in the body, even in the blood arteries, making smokers significantly more susceptible to heart attacks. So compared to all patients, non-smokers to smoker, there is a 10 times risk of heart attacks in smokers. So be aware of smoking. Stop the smoking as soon as possible if you are an addicted of smoke. Then diabetes. Diabetes affects the blood vessels, nerves, and including those supplying the heart. High blood sugar also marks the symptoms. So particularly in women, making early detection is more difficult. Diabetes itself, it acts on autonomic nervous system. So where the nerves are there, where the pain sensitive areas are there, pain sensitive areas will be numb. We can't get classical anginal symptoms like chest pain, radiating pain. We won't get in those patients. Simply they will present with failure signs like breathing difficulty, uh, swelling in the limbs and chest pain, some patients, and other symptoms what we have discussed, giddiness and all. So diabetes is a major silent killer for patients for heart attacks. So, and then obesity and inactivity, excess weight gain, sedentary lifestyle, lack of exercise increases the strain on the heart and are often associated with high blood pressure, diabetes, high cholesterol. As we have discussed with Ravi Kiran sir, say metabolic syndrome here we can see. So last and foremost, family history and age. Family history, when patient having familial diseases are there, some patients will have heart attack, sudden cardiac arrest, and some patients have cardiomyopathies. So age also raises your vulnerability, like more than 50 years, long-standing diabetes. These patients will have natural stiffening of the arteries and weakening of the heart muscles. So how is heart attack diagnosed? So we have gone through the warning signs and symptoms and then risk factors. Now, how can we prevent? How can we diagnose? Prevention is better than cure. We can say that. So what are the preventive measures we can take? So how can we diagnose? So prompt and accurate diagnosis is essential to reduce the heart damage and improve survival chances. Healthcare professionals uses variety of methods. We can say first and foremost always ECG, electrocardiogram. This test records the electrical activity of the heart, helping to detect patterns that suggest ischemia, whether infarction. There is a differentiate between ischemia and infarction. Ischemia is artery is going to block. There will be some flow to the arteries, but infarction is completely occluded artery. So there won't be any flow to the heart. So always think ischemia, infarction on ECGs, there will be changes in the ECGs. So once, even though healthcare professionals, even though practitioners, they don't know about the lot of the people will confuse with the ECGs. So go for ECG training and be, when you are having some doubt, don't say this is normal. Send to the higher centers or physicians, they can diagnose, and cardiologists they can diagnose. So ECG for and foremost, always prior when patient having what are the symptoms, go for ECG first. Then we can call it as a mother of all diagnostic tests, ECG. Then what are the blood tests? So when patient have ECG changes, heart attack changes are there, whether it is really heart related issues are there, whether some other changes we can think of that. So blood tests such as in heart attack patient, troponin mainly, which is an enzyme released during the heart muscle damage, which occurs and confirms the heart attacks. Their levels will be there, and we can a diagnosis and differentiate between other mini heart attacks like unstable angina, stable angina. So when troponin is raised, we can call it as STEMI and STEMI. So STEMI and STEMI having both positive levels of troponin. Unstable angina have negative troponin values. So next, what are the imaging tests? So echocardiogram and coronary angiography provide the real-time visuals of heart function and identify the blockage of the damaged tissues. We have seen the most of the patients, they come for directly echocardiogram without ECGs. This I want to focus on this. Why? Because echocardiogram will delineate your whole heart pumping and what are the walls, what are the muscle thickening is there or not. So we need to see the overall pumping by the echocardiogram. But when patients having ongoing angina, ongoing pain is there, even that time also 2D echocardiogram will be normal. But we need to focus on the ECG, blood test. So this overall combination of the one combo pack will be there when patient having chest pain. So always think of that and identify the blockages and damaged tissue and go for further. So what is the clinical evaluation? So these 3-4 tests are, this helps to diagnose. So combining with these tests and symptoms, history, risk factors, and physical examination will help the patient to assess likelihood whether it is heart attack or even before lab results come. So what are the prime modalities of treatment for heart attack? So goal of the treatment is to restore the blood flow to the heart muscle and prevent further damage. When patient having heart attack with 100% of the blood, 100% of the artery occluded, so we need to revascularize. We need to open the artery as soon as possible. So within fraction of second, we need to react. Here we can call time is money, time is everything here. So here we can come with the medications. What are the medications? So first, when patients having chest pain, we can give sorbitrate, whether it is heart attack or not. Without confirmation, also we can give sorbitrate. Whether patient BP blood pressure is maintained, having chest pain, we can give this. So first, aspirin, and antiplatelets. We can dual antiplatelets. Nowadays, we are having ecosprin and ticagrelor, best antiplatelet nowadays. So aspirin, clopidogrel, ticagrelor we can use, and thrombolytics like tenecteplase, streptokinase, we can use to thrombolize. Whatever the blood clots are there, we can melt it with these injections. So then beta blockers, nitroglycerine, and other diuretics, which reduces the heart workload and improve the blood flow. So immediately after diagnosis of heart attack, so one patient comes to the hospital within window period, within 45 minutes, within 90 minutes, once the patient comes to the hospital with the diagnosis of heart attack. So in that patients, we need to take the patient directly to the cath lab. Window period will be from door to needle period will be there, door to needle. One patient comes to the hospital from his door to the cath lab. Once we are entering with the needle, so this call as door to needle period. So door to needle period should be very less, so we can restore the blood flow and we will stop the damage of the further heart muscle. So here angioplasty, coronary angiogram will be done. Once we have seen the blockages, go for angioplasty. This procedure uses a balloon and stent which open the blocked arteries, improve the blood flow and prevent the further heart damage. And another one is the coronary artery bypass grafting. There will be misconception that lot of patients, and what is the difference between stenting and bypass? What will, in what way stenting will help? In what ways CABG? What patients can prefer for CABG? When patients have multiple blockages and multiple stents are needed to restore the blood flow, and patients having high risk of diabetes, in those patients multiple stents and multiple areas to open it up, and there will be a lot of metal load will be there when we are putting multiple stents. So in those patients we can go for bypass surgery. Instead of going for stenting, we can go for bypass surgery. But nowadays bypass surgery patients won't prefer. Why? Because there will be cutting and open heart surgery will be there. So most of the patients won't go directly for bypass surgery. In those patients, we can suggest, if they are not willing, we need to give the positive way what we are going to do, how we are going to restore his blood flow. So stenting is the best one for those patients. And Even though this stenting and bypass surgery patients will need to continue the antiplatelets to restore their blood flow lifelong. So, and what about after this stenting done? What are the lifestyle modification? What are the cardiac rehabilitation? So post-treatment care is important, very important, which includes structured rehabilitation programs, dietary counseling, stress management, smoking session, and regular exercise to reduce the future risks. And diabetes control should be there. And whatever the risk factors, like smoking, alcohol, and other risk factors, we should stop it, all those things. So how to prevent? Adapt preventive measures greatly reduces the chance of suffering from the cardiovascular events. Maintain a healthy heart diet and eat foods in the rich with fiber, omega-3 fatty acids, antioxidants. Avoid processed food, junk foods, excessive salt, sugar, unhealthy fats. So regular exercise, 30 minutes per day, five 5 days a week. We can go 150 minutes per week, 5 times a week, and strengthen your heart and helps control weight and blood pressure and blood sugar. So what about control chronic conditions like diabetes? We can uh, hypertension and high cholesterol, thyroid with medications and regular health checkups. We can and what about smoking and alcohol? So always say that don't tell that limit the alcohol, quit the smoking, quit the alcohol. That's better thing. So uh, always those things we need to stop. And what are the warning signs we should aware? We have discussed. So always think of that. Warning signs should be there, and you are at a risk. So go for further tests. Early diagnosis and prevention is better. So some patients having heart attack and cardiac, there will be a lot of differences. They are confusing with I had heart attack or cardiac arrest. So there will be lot differences. It's important to understand that while both are life saving and life threatening, they are not the same condition. Heart attack is usually caused by blocked arteries and presents with symptoms like chest pain, shortness of breath. The heart usually keeps beating in heart attack. It's an attack. It's not completely stoppage of the heart. In cardiac arrest, there is sudden electrical malfunction that causes the heart to stop. Here, stoppage of the heart, completely heart will be stopped in the cardiac arrest. It occurs without warning and leading signs, which leads to unconsciousness. Immediate CPR, defibrillations are needed in this condition. So, understanding the difference between these two, and conclusion, recognizing the warning signs, red signs of the heart attack, which are chest pain, shortness of breath, fatigue, and radiating discomfort, which is crucial for the early intervention and survival. Women may experience the most subtle symptoms, making awareness even more important. So, being informed about risk factors and diagnostic tools and treatment options improves individual to quick and make heart healthy. Thank you.
Thank you, Dr. Vinod, for such an enlightening and wonderful presentation, which was quite informative and quite important in today's age. Now, Dr. Vinod, I have a couple of questions for you. How can someone differentiate between acidity, indigestion, and a possible heart attack? You see, a lot of patients you might be getting that I have chest pain, and then when you diagnose, it probably turns out to be just a minor case of gastro.
Yeah.
So how do we differentiate?
We've seen in emergency cases, a lot of patients will come with these symptoms. So most of the time we misdiagnose, mislead that it can be gastritis also. So here one main tool is that I have to tell that ECG we need to take first. If ECG is normal, we can be relaxed, but we can't ignore completely. It's not cardiac, but always ECG says that if patient presents with these symptoms, definitely there will be inferior wall MI, we can call it as acute coronary syndrome. There will be blockage of right-sided coronary arteries. RCA will be there. Some blockages will be starting in the RCA. In those patients, similar complaints of gastritis, epigastric pain, center of the below stomach pain will be there, upper chest. So these pains will be there, nausea, vomiting will be there. Some patients present with loose motions also. We always, some patients loose motions, we can call it as acute gastritis, acute diarrhea is there. So we can misdiagnose 2 to 3 days. They will stay at home. They will present with hypotension. BP will be lower side, and then they will land up into the acute kidney injury. So finally, they will come with metabolic multiple problems. some problems, they will come to the hospital. So initial diagnosis will be taken by ECG and proper diagnosis, proper symptoms evaluation in the emergency care itself.
Thank you, Doctor. Now, in line with the recent World Heart Day, which we celebrated, I have a question on that because there is a lot of awareness required for people to take care of the people who have suffered from a heart attack, right? So, my next question would be, what immediate steps should one take if they suspect a heart attack in themselves or someone nearby?
Yeah, first they need to approach the hospital. Most of the people nowadays, they're easily getting medicines nowadays. Like once having pain, they can think of gastritis and they will take some Pantop and they will rest for one day. Then they will think of this delay will be there in the process, and lot of awareness programs are there. But even though that the Google will make the patients into worsening, sometimes they will help in other way, one way, but worsening in another way. So one patient having chest pain or some symptoms, warning signs are there. Simply they can go to the hospital, nearby hospitals, go and take a ECG, consult your physician or cardiologist. Just take your opinion. It won't waste our time. It will save our life. So once ECG tells, some signs will be there when patients having, even though ECG is normal, patient having symptoms, symptom is very important. When patients having the symptom, definitely we should not ignore. Always symptoms are on the priority basis. Even though blood tests are negative, blood tests are positive, symptoms are important. I have one experience. I will tell you one thing. When I was practicing cardiology as a resident, at that time one patient came a long way, like some 200 kilometers he traveled with the chest pain. They came to the emergency department, and ECG was normal, 2D echo we have done normal, and blood test also normal by that time. And we thought of that gastritis. One of my colleague was there. He thought of gastritis, and he has given some medicines and sent. He went to home. On the way he got again pain. Then he came back to the hospital early in the morning, 4 o'clock. He presented with massive heart attack. Thing is that we should not take it lightly that all things are normal. When patient presents with the symptoms, definitely we need to, whether it is normal only, suppose ECG normal, 2D TMT normal, then we can relax, bit relax. Go for extensive approach, and extensive is our heart only life. We should not take risk. So be aware of that, take a better way. And in younger patients, ECG, 2D echo, then go to the TMT. If TMT positive comes, go for CT coronary angiogram. Whether you have really having chest pain or risk factors, sleepless nights, stress, smoking, those patients also, there are doubt, benefit of doubt will be there that whether I'm having some heart problem or not. Go for CT coronary angiogram. CT calcium score will be there. So once abnormal will come, we can go for coronary angiogram, conventional angiogram. We can go for that.
Thank you, Doctor. Thank you for that informative answer and quite. And thank you, Doctor. Thank you for the information, and thank you once again for being with us today. So, everyone, stay healthy, stay informed, stay safe, and stay happy, and avoid smoking and excess of anything that is sugar or salt or even junk food, and that will help you stay healthy and away from any disease that could be fatal. And and we look forward to seeing you in our upcoming webinars. Till then, stay healthy. Thank you.